Thank you for joining us for Denver 7 News at 5. I'm Ann Trujillo, joining you from my remote home studio.
I'm Shannon Ogden here in the Denver 7 studios, and as you see, we continue to do our part, increasing our social distance. In fact, we're doing this throughout the entire television station, so do bear with us. There may be some technical glitches as we ramp up our effort to work remotely here. All right, on to the news now. Within the last hour, we got an update on the coronavirus in Colorado. Today, there are 2,627 cases in our state. 414 people are in the hospital, and that's a dramatic jump from last week. And the death toll continues to rise. 51 people in Colorado now have passed away from the virus. And outbreaks at long-term care facilities are growing as well. The state is now tracking outbreaks at 14 facilities that house our most vulnerable. Another perspective of the data for you today. Colorado had 320 more cases today than we had yesterday. That's the curve we're trying to flatten by staying at home. But today, Governor Polis explained that it's going to take about 2 weeks to see the effects of the efforts that he has taken. And this week, we expect to see the impacts of the closures of bars and restaurants. And the governor using that data to back up his policy decisions at a press conference today. Speaking alongside the governor, a doctor from UC Health talked about what he's seeing right in the front lines. Denver 7's Jessica Porter breaks that part down.
The good news, the growing number of cases in Colorado is losing a little steam, from doubling every 2 days to every 5.
That is still an extremely contagious virus, which shows why just closing the bars and restaurants wasn't enough.
But the governor and UC Health Dr. Mark Moss stressed the virus is not just impacting older people. A COVID-19 patient in their 40s has died, and they're seeing younger and younger patients.
And some are as young as 19 years old. Many of these patients were healthy with no other pre-existing medical problems. So I want to emphasize that healthy people can be infected with this coronavirus and become critically ill.
The governor's big focus, protecting our healthcare workers. He says the state is working with the private sector to acquire more personal protective equipment. The state needs over 1 million surgical masks, 203,000 face shields, and 120,000 pairs of gloves, along with other equipment.
They are working to creatively acquire these personal protection equipment in a really challenging global time frame when everybody's trying to buy them.
Dr. Moss says the ICU at UC Health is seeing double the amount of patients due to COVID-19. The average hospital stay, 20 days. And healthcare workers are starting to test positive for COVID-19.
I'm concerned. I've never seen anything like this in my career. There are intensive care units filled with people that look like you and me that are on life support systems.
Jessica Porter, Denver 7.